Good afternoon. Today I'm joined by Mayor Tom McNamara and Lisa Brown from the Rockford Mass Transit District to give you an update on everything that's going on there as they begin to restore their services. So once again, I'm going to give a reminder, we are in the weeks approaching school, and we're going to call it back to school or mask to school. We are working to get our schools ready and prepared, and I keep reminding folks, because as we get closer, we are almost only 2 weeks away from many of the school start dates in our region, and it becomes important that we prepare ourselves as a community, as parents, to begin to bring our children back into the school setting. And again, like the healthcare systems and the rest of us, schools are going to learn to coexist with COVID. Both public and private schools in Winnebago and Boone counties have been working to make the necessary adjustments. They are working to reduce the risk of transmission in the school settings to staff, students, and their faculty. But once again, we're going to talk about being intentional. They want to be able to support both remote and in-person classroom, recognizing that as we talked about this in the past, there'll be rolls, there'll be waves, but we want to make sure there are trickles. Guidance will include universal face coverings. We've talked a lot about that, but we continue to help as parents begin this process to prepare their child to wear the face coverings while in school. Social and physical distancing, cohorting in classrooms in the elementary grades, reducing class periods and during the day to decrease the number of contacts. You'll hear today about mass transit and bus transportation, but the same concepts are going on in school transportation. Lunch times, as we know them, will be very different for those grab-and-go periods. How do we educate children with special needs and make sure that they are integrated in the classroom learning environment? Health checks is the norm, and increasing sanitation. But I'm going to emphasize again, while the schools are doing their work behind the scenes, the teachers, the custodial, the maintenance crews, the superintendents, all of them are doing their part, but we need our families to do their part to help keep the risk of infection low and to reduce the number of exposures. So as you begin this process, think about those outside school activities, including parties and sleepovers and tournaments, the clubs your children participate in, organized sports, religious education. Schedule your appointments now for needed school physicals and vaccinations. We want you to be ready to return to school. And we want you to practice masking with your children if they haven't been doing it over the summer so that they are ready. But again, the idea is to be intentional. The schools are planning intentionally to have you return, and families must plan the same to be intentional to return their children to school. I've had a lot of questions as we end through the summer months and as we continue through this beautiful weather of travel guidelines. I've asked, can we enforce travel guidelines? This is something incumbent on everyone in our community to understand that these are out there to help employers, to help community residents understand how we can continue to keep our disease transmission low. We ask that you review the guidelines and understand that the intent is to decrease disease transmission. It is not a ban or a travel restriction, but it's understanding what in areas we might have to be careful about as we travel or we have visitors from. We encourage the employers to adopt policies to support best practices, to understand the need to provide for remote work capability if you have to quarantine someone or you feel that it's the best practice so that they do not come into your workplace or environment to protect your other workers. How can you help them, support them to be able to work remotely? How do you plan for that employee, or if you're a school or an educational institution, how do you plan for that student and that faculty to return? Once again, the word I want to remind people of, it's intentional. We can't just continue to do business as we've done it, and we have good numbers today because I think people are being intentional. But with each area that we open up, each sector that we move through, we have to be further intentional about our actions so that we can take the necessary steps. At this time, we want to be able to bring our children back into the educational systems and learning environments. I want to thank all of our mobile testing sites. We had a great week last week. Through their combined efforts, over 577 individuals were tested in those pop-ups. So Rockford Housing Authority, La Chiquita Foods, South Beloit High School, Winnebago County Housing Authority, and Winnebago High School and School District 323 that were our hosts for last week's pop-up sites. And again, we wanted to make sure that people know that you can come to any of these pop-up sites, drive-up sites, or our two more permanent locations at the College of Medicine Health Sciences campus on Parkview, as well as at Auburn High School. For a complete list of all of our testing sites over the next 2 weeks, you can go to wchd.org/COVID/gettested. Lack of testing should not be a reason in our community that we have to then consider rolling back at any point in time. So again, thanks to everyone for their intentionality, because of those efforts today, we are only reporting 11 new cases for a total case count of 3,505. We have no new deaths to confirm. Our rolling 7-day positivity rate is just under 4% at 3.9%. And our overall positivity rate, those of us who follow us on a little more regular basis, is up from the high of, close to 18%, is now at 7.3% overall. And the good news is 96% of our residents who have contracted COVID-19 are reported as recovered. We have no new locations of concern and no new communities of concern. So again, the reminder is continue to do the good work you've been doing. We are intentional about the actions we are taking. We want our children to be able to return to school in the next couple of weeks, our universities to be able to welcome our students into our region and area, but it requires all of us to be intentional. So with that, I would like to introduce Lisa Brown from Rockford Mass Transit, who will talk about all the intentional things they have done to make riding mass transit safe.
Thank you, Dr. Martell and Mayor McNamara, for having us here today. We certainly appreciate being able to spread the good word. Rockford Mass Transit is very pleased to announce that on Monday, August 3rd, we will be resuming our regular pre-COVID-19 route system. We would also like to inform our passengers that while service is starting on Monday, August 3rd, fare collection will not start again until Monday, August 10th. And it seems like it's been a very, very long time since RMTD ran regular service, so let me take just a minute to remind you what that looks like. Our standard weekday service consists of 19 routes serving Rockford, Loves Park, McChesney Park, and Belvedere between the hours of 5:15 a.m. and 6:15 p.m. At 6:15 p.m., the weekday service transitions to our night routes, which run from 6:15 p.m. until 11:15 p.m. in Rockford only. The late night shuttles will also run at 11:15 p.m. and will continue until midnight, transporting people who make final transfers to their final destination along the night routes. Saturday routes will also return to their pre-COVID-19 service levels starting at 6:15 a.m. and Sunday service remains unchanged. For more information, passengers should visit our website at rmtd.org, where all of our maps and timetables can be found under the Travel tab on our homepage. So we're very happy to be going back to our regular service, and we invite our passengers back on the vehicles. Well, when passengers do return to our regular service, we have a few things that they will notice that is a little bit different that we are asking that they be mindful of. First of all, on August 3rd, we will resume front door boarding again. Currently, we're doing rear door boarding. On August 3rd, we will resume front door boarding. Passengers will once again use the front doors and are being encouraged to exit via the rear doors now. So this will eliminate any congestion in the front of the vehicle. Next, in accordance with the guidance set forth from the Winnebago County Health Department, all seating areas on our vehicle will be available August 3rd, and all passengers will be required to be seated. We will not have any standing passengers at all at this time. The number of passengers, therefore, will then increase from the current 10 that we have now to 28, 29, or 32, depending on the vehicle size. And again, there will be no standing room only. However, we do not anticipate standing being an issue, as our ridership has dipped a little bit since our pre-COVID days, so we don't anticipate this being a problem. Passengers are still encouraged to spread out whenever possible on the vehicles. And as I said, once again, our fare collection is not going to start until August 10th. At that time, we have extended the time on our transfers from 60 minutes until 90 minutes, thus allowing passengers to board at the front of the bus, pick up their transfers, be seated, and exit at the rear doors, rather than getting their transfers as they exit. This, again, will eliminate congestion and hopefully help with social distancing. We hope to be introducing a mobile ticketing app very shortly in the near future. We don't have all the details worked out on that, but please look at our website and follow us on social media for announcements on that, because that will be coming very shortly. And that, we hope, will also eliminate hard surface contact for both our passengers and our operators. Effective August 3rd, there will also be other measures that we have introduced on our vehicles to keep our vehicles and our passengers and our operators all safe. We will be having 2 hand sanitizer stations on our fixed route vehicles and 1 on our paratransit vehicles. On our fixed route, we will have 1 at the front of the bus and 1 at the back of the bus. Passengers are encouraged to sanitize as they board our vehicles or use the sanitizers anytime they feel the need. We will also continue our aggressive cleaning measures, and that will include continuing to wipe down all of our vehicles that are in service during the midday hour. We will have our buses cleaned nightly with disinfectants, and we will also continue our systematic fogging that has taken place. And most importantly of all, passengers will still be required to wear their masks or other facial coverings that covers both their mouth and their nose at all times while on RMTD vehicles. Passengers not wearing facial coverings of some sort will not be allowed on the vehicle. And finally, we would like to extend our thanks to Dr. Martell and your wonderful staff, to Chairman Haney, who's not here, but we want to thank him, and Mayor McNamara. Your guidance and leadership and support over these last few months has been greatly appreciated by everyone at RMTD. If there are any other questions, I encourage you to check out our website at rmtd.org. Call us at 815-961-9000 or see me after the press conference. Thank you.
Good afternoon. First, a sincere thank you to RMTD. Lisa and Michael Stubby have done a tremendous job, I think, in really helping set really wonderful examples from the very beginning of this pandemic. Obviously, it cannot be easy for any mass transit authority to move through this global pandemic, but you've done it with grace and with compassion for your riders and thoughtfulness for employers as well. So thank you so much. Dr. Martell, again, thank you for the tremendous work that you continue to do. Especially impressed with the mobile sites. To hear 577, I believe, was the total number of individuals in these hard-hit areas that are getting tested now is really phenomenal, and I'm thrilled to hear that they're going to continue. Just want to say, as we look across the state, as we look across the country, we're seeing high increases in cases, but here in Winnebago County, we have been hovering around that 4% positivity rate, and Dr. Martell announced today that 3.9% positivity rate, so we don't want to miss that 0.1%. I think there are lessons that we can see of what we don't want to do when we look across the country, but we have our own lessons here of things that we do want to do. And I want to applaud several business leaders and organizations. Just this past Thursday, I was joined at a press conference with the Visitor and Convention Bureau, the Hospitality and Tourism Working Group, the Restaurant or the Hotel Association, and several small businesses to discuss the importance of making sure that everyone's wearing their face covering. The science is incredibly clear on wearing face coverings. Wearing a face covering or a mask when you're out in public or around people certainly helps the spread of this virus. When I wear a mask, it's to protect you, and when you wear a mask, it's to protect me. We need to continue to heed the advice that the health department has issued now for several months that wearing a face covering is critical. The health department has done a great job of educating and bringing awareness to individuals and businesses throughout our community. And this past Thursday, myself and nearly every mayor throughout Winnebago County has signed on to ensure that our local staffs at each one of our cities or villages will dedicate resources to ensure that we help with that education and awareness to all of the businesses to make sure that their employees and their patrons are wearing face coverings, as we know it's one of the simplest, easiest things that we can do as a community collectively to benefit everyone, especially our positivity rate. So again, this is the time to be vigilant. Make sure that every single person is wearing a face covering. Make sure that you are washing your hands regularly. Make sure that if you have an event that can be taken outside, bring that event outside. And make sure that you're practicing that social distancing. The last thing I just want to mention, obviously there's a lot going on in our community right now and across the country. There's a number of crises that are going on, and typically in times of crisis, we have a number of things that are impacted, but domestic violence is certainly one of them. Just this past Monday, our Family Peace Center began seeing clients, and I want to give a specific message to those survivors that are out there that may be watching this. We're here to help you. We hear you and we believe you, and there are a number of resources in our community that are waiting to be along your side during that difficult and courageous journey. So I'd urge you, please, reach out for help. Call the Family Peace Center. You can call the Family Peace Center if you are in need of assistance by calling 779-348-7600. That's 779-348-7600. Thank you, and we'll take questions.